Good morning, everybody. We'd like to welcome you to our client webinar series for September the 23rd. My name is John Cobble, a compliance specialist here at Pro Benefits, and joining me today is Laura Bibb, our Senior Compliance Counsel. We're going to split the topics on today's webinar. I'm going to do a brief review of the COVID-19 legislative changes and a reminder of how those may affect your plan. And then Laura is going to discuss leaves of absences in a little more depth and detail for you. Just as a reminder, you can ask questions anytime during the webinar, and we will answer those as we're able to. And if we're not able to during the webinar, we will be sure to follow up with all those questions. We have also posted frequently asked questions on probenefits.com. You'll find those resources up at the very top of the web page, both for plan participants and for employers and advisor partners. We are updating those as frequently as we can get new information, so be sure to check back there regularly. Additionally, want to draw your attention to some of our recent webinars that have focused on the COVID-19 changes with a little more depth and coverage. And then also educational and training materials for these and other topics are always available from our compliance team. We don't want you to forget about the mobile app for participants. It's one of the easiest ways for them to file claims as well as to interact with our staff and with their account, and also to make sure that they are following on social media. As we all know, it's the best way to get updates quickly and hopefully accurately these days. And so we are trying to encourage folks to follow us on social media with a few giveaways and promotional things. So it never hurts to win something and also to stay informed. And then, as always, we're available to help both administratively and compliance team every day. To briefly review the legislation that I'm going to talk about, this is just a reminder of when the legislation came out, starting in about mid-March, and then we haven't had any significant changes since May, but as always, we're keeping an eye on the IRS for new notices and changes. If you follow the news, you know that they are still considering some additional changes, so we're trying to keep an eye on that, and we'll let you know as soon as we know. One of the primary things that your participants and employees will certainly want to be aware of is the over-the-counter drug and medication change. That was, if you're a new company or new FSA provider, you may not have known that the OTCs weren't permitted for a while, but now that they are reimbursable by FSAs, HSAs, and certain HRAs without a prescription, it makes it a lot easier for employees and participants to use their elections. But be sure to make sure that they are aware of it as they plan for their elections in the upcoming enrollment periods. Another one for consideration during the upcoming enrollment period is the IRS increase in FSA carryover. For those of you that have carryover on your plans, it did increase from 500 to 550 and will continue to be indexed in conjunction with the IRS election maximum going forward. So we will update that, periodically as it's updated. You'll notice there a quick note about plan amendments. We are updating plans and plan documents along with timely IRS requirements. If you haven't received yours yet, we are working on those, and we will have them to all of our clients in compliance with the IRS's allowance. The claims and appeals deadline has also been extended. Just as a reminder, you'll see there bullet 2 that this specifically applies to FSA and HRA plans with a run-out period that ended after March 1st, which essentially applies to 2019 plan years, but does not impact the date of service. So the date of service still had to have occurred in 2019, but the extension for making those claims has been extended for longer. This change, IRS Notice 2020-29, you'll see that this applies specifically to calendar year 2020, and as of now, is only providing an extension for plan years or grace periods that end after January to go through the end of this current year. You'll notice the parentheses there that for those plans that have HSAs or considering moving to HSAs, this may affect eligibility for an HSA. But additionally, this notice provided plans the option to allow mid-year election changes. And as with all of these changes, that's optional for the group, and plan amendments are required and needed for those, and we are applying those as we discuss them with you, the group, and get those updates to you timely. As a side note, just so that we're covering all of the changes, we won't go in depth about these, but just as a reminder, through the pandemic period, COBRA deadlines and HIPAA special enrollment deadlines have been extended. Currently, that extension is an indefinite extension until the end of the outbreak period or the end of the national emergency. So there's no definite endpoint to this yet, but we are continuing to send timely notices, and you may have noticed a supplemental notice that we are sending out to COBRA eligible beneficiaries that gives them a little more information about the COVID extensions and explains that we will continue to operate our practices as normal, and we will update you when this outbreak period ends to give you an idea of how these particular extensions will resolve. I'm going to turn it over now to Laura, who's going to discuss leaves of absences in more detail.
Thanks, John. In addition to the COVID changes that John just reviewed, what we're seeing is that leave of absences continue to be a key issue impacting employers. This was true pre-COVID and is even more so true during this pandemic. I know from our compliance team, we've seen lots of questions. They've come in waves, but we're seeing a lot more questions during the pandemic about leaves of absences and furloughed employees and how benefits should be handled. So we want to talk to you today about some important points and best practices to remember as you encounter these situations. Leaves can be simple or they can be complicated. Often they are complicated, but communication is key, and not only communication with the employee, but also with your carrier partners to make sure that you're operating consistently with their policies, and also to make sure that as an employer, you're being consistent with your own policy or FMLA if applicable. We recommend that employers have a formal leave policy in place. Certainly, it's easier to address leave of absence issues on the front end of the leave, but a lot of times that may not be possible. So having a policy in place does help allow you to address those situations promptly once they arise. Making sure that you understand what other laws may apply, such as FMLA or FFCRA, and then understanding and considering benefit elections and how those will be handled in addition to the employment status of the individual. So this is really an overview of the key eligibility scenarios we see. Typically, individuals are going to fall into one of these categories, and we're going to discuss the key issues to consider that arise in these scenarios. So what we have seen is employers are frequently using the term furlough during the pandemic to refer to employees who may not be an active employee. So the first question is there a change in status or termination of employment? If neither of these things has happened, the employee is an active employee, and you're proceeding as if they were an active employee. Sometimes employers are leaving employees who might otherwise be in a leave on as an active employee, and we would just refer you to your policies and also the carrier policies to make sure that you're handling that in a way that is consistent. If there is a change in status, rather than focusing on the terminology, so rather than focusing on the furlough terminology or whatever term is being used by the employer, I would urge you to consider the actual employment status. So is the employee active? Are they on a leave, or are they terminated? So it's going to be one of those three things. In essence, a furlough is really an unpaid, or can be really an unpaid leave of absence. So then the question becomes, is the furlough really an unpaid leave, or is it a termination of employment? And the answer to this question is going to impact benefit issues, including the issue of whether an employee is a rehire if they're terminated, or are they really returning from an unpaid leave of absence. So these are all questions that need to be considered as you're addressing these situations. Certainly, there are unique issues for active employees if it's an employee who is possibly on a leave if you don't have enough work for them, but you're treating them as an active employee, and unique issues for terminated employees. But today we are going to focus on leave of absence issues and best practices. So the two initial questions for a leave of absence is, one, what type of leave is it? Is it an FMLA leave or a non-FMLA leave? And that's an important distinction because of the FMLA requirements that apply in effect benefits. And then is the leave paid or unpaid? That's going to impact how the premiums are paid if coverage is continued. And then also we want you to make sure that you're looking at your leave policy. What does it say? Especially for those non-FMLA leaves, a best practice would be to have a policy and make sure that you're following it. Also, again, communicating clearly is always important, how the leave is going to be handled, how benefits are going to be handled. And we're going to talk a little bit about premium payments in just a few minutes. So I'm not going to get into the nuts and bolts of the different types of leaves, FMLA and FFCRA. I've included some helpful information here, and we can provide further information or resources or answer any questions that you may have about these leaves. But I wanted to include this in your slide material so you have it. But again, just given the time today, we're not going to get into the nitty-gritty on these leaves. Do note that FMLA does provide job protection and also coverage protection. So that's important to remember if you're dealing with an FMLA leave situation. The FFCRA provides some additional benefits, and the key here I want to note is that FFCRA may impact employers, that are not subject to FMLA. So even if you're not subject to FMLA or you've not adopted an FMLA-like policy, you may be required to comply with the FFCRA. And the first part of this is additional sick leave, emergency paid sick leave that's related to COVID or COVID diagnosis. And then the second part is essentially an additional FMLA category that's COVID related that does have a paid component to it. So most FMLA generally is unpaid unless the employee is using their own sick leave time or vacation time. But this this FFCRA does provide a paid benefit. I want to note that this was effective in April, and it actually ends at the end of 2020 unless it's extended or some other benefit or relief act is passed. So you may have some folks who have been on FFCRA who've been receiving paid leave and paying pre-tax. So you'll need to consider that as you move forward. Since many employers are heading into a renewal season, now is a really good time to revisit benefit elections during a leave and to take a look at who you currently have on a leave and how their benefits are handled. Just as a reminder, for FMLA and FFCRA, the group health plan coverage is continued. It must be offered at the same level and under the same conditions prior to the leave, and that includes premium payments. The non-FMLA may be different based on your own policy, or you may decide to treat non-FMLA leave similar to FMLA, and we'll talk about that in just a little bit. I also want to remind you not to forget about open enrollment rights for those individuals who are on a leave, especially if it's FMLA or FFCRA. Those folks have the same open enrollment rights as your active employees have. So you need to make sure not to forget them come open enrollment with the materials and making sure that they are making their elections. If an employee doesn't continue coverage while on the leave, it's important to note that when they return, they are entitled to have their coverage reinstated on the same terms as before without additional eligibility requirements, so without a waiting period. So this is important. We talked about making sure that you understand, what an employee's status is, if they are on a leave or if they are truly terminated from employment, because this is going to affect when they come back, whether you can impose a waiting period if they're a new hire or potentially a rehire, or whether you have the situation of someone who's returning from a leave and the waiting period may not apply. And just as a reminder, John talked about the COVID changes to the 125 change events. A reminder for those for FMLA and non-FMLA leave, generally the start of the leave is a qualifying event, so that the employee could change their status and revoke their coverage. If so, return from the leave is also a qualifying event. But if the coverage is continued, there wouldn't be a qualifying event. So we talked about FMLA and the FFCRA. Non-FMLA leaves allow employers a little bit more flexibility. So for a non-FMLA leave, the employer has the ability to set a policy on how you're going to handle benefit elections, how you're going to handle the leave, how premiums are going to be paid, whether the employer is going to actually subsidize a portion of the premium. So it's important to have a policy in place and make sure that you address these key issues. Sometimes employers will adopt an FMLA approach for their non-FMLA leave, but not always. So you need to think through how you want to handle leaves that are not FMLA related. And again, communication is key, making sure that you're being consistent not only with your own policies, your own leave policies on how benefits will be handled, but also with the policies of your carrier. For payment of premiums, there really are several options on how this can be handled. The first is that the employee could pay before they go out on leave with pre-tax dollars. The most common example I think we see of employees paying before leave is with maternity, but certainly there may be COVID-related leaves or COVID-needed leave that the employee can anticipate, but oftentimes there may be situations that the leave isn't anticipated. So there may not be the option to pay before the leave with pre-tax dollars. If the employee is paid while out on leave, they could certainly continue to pay their premiums with pre-tax dollars. But if the if the leave is unpaid, then the option would be to pay as you go with post-tax dollars. The last option, I would say, is probably the least favorable option, but the employee could return from the leave and then use pre or post-tax dollars to catch up the contributions that they missed while they were out. And I would just caution you to remember that an employee may decide not to return. So you may want to think through the risk there of adopting this option for payment of premium. Again, the employer has flexibility, but the best practice is to address payment of premiums at the start of the leave whenever you can. One of the most difficult issues for employers is if and when to terminate coverage in a situation where you have an employee who either doesn't return from a leave or has a leave that extends beyond FMLA. So in addition to the best practice of having a formal policy to address, it's also important to know what the benefits, the documents state for each benefit that you offer. So what does the SPD say? You want to make sure that any termination of coverage is consistent with both your policy and that the underlying SPD for the benefit. And then finally, consider any carrier contract provisions or ASA provisions for a self-funded plan. One common provision that we see for fully insured plans is that coverage for an inactive employee ends after 3 calendar months or 13 calendar weeks. So that captures the FMLA and we capture the non-FMLA leave. Some carriers do allow a longer period, but we recommend that you check with your carrier to be sure that you understand what that policy is. And I will say that at the beginning of the pandemic, we started to see some carriers extending their own policies to allow inactive employees to stay on a benefit plan longer than the traditional common practice of the 3 calendar months or 13 calendar weeks. So just make sure that you check with your carriers, and I would also caution you to check with all your carriers because your health carrier may have a different policy than, say, your dental or vision carrier. So making sure that you understand what those are. And then finally, if all of this wasn't complex enough, don't forget the ACA. For all of you that are applicable large employers, make sure that you remember the stability period requirement for group medical and the requirement to make an offer of coverage. So you may have an employee who is in a stability period and has their coverage terminated. So you may need to think through those issues and how that would impact COBRA. The bottom line really is that leave of absences can get complex very quickly, and even more complex when we add the additional layer of COVID and the COVID implications that businesses have been affected with since the start of the pandemic. The key is making sure that you're handling the leaves correctly, considering what status your employee or the individual falls into, making sure that you have policies and that you're being consistent with both your policy and the carrier's policy. Finally, we are always here, as John mentioned, to help you. So if you run into a leave of absence issue or an issue that you think might be a leave of absence issue, feel free to reach out to us. Give us a call or email us and let's talk through it. Even if it's not the beginning of the leave and maybe it's towards middle or you're not sure how to handle it, give us a call and let's talk through the issues and how it impacts benefits and your plans. I know we've reached out to several to confirm when we've received information about a rehire, just to make sure that it is in fact a rehire and not a leave of absence situation. So again, best practices: confirm that you have a written leave policy. If you don't have one, put that on your to-do list. Be prepared to determine whether FMLA applies. And remember, there are also other laws that could apply and create wrinkles, including the ADA. We didn't talk today about USERRA, but USERRA is another leave law. Make sure that you document and clearly communicate to the employee at the start of the leave and what happens at the end of the leave if the employee doesn't return. And then finally, make sure that you calendar the end of the leave so that coverage can be handled appropriately if the employee fails to return. And we've got a note here that, generally it's the 12 weeks or 3 months, and then coverage is terminated and COBRA is offered. I will reiterate that just making sure that you check with your carriers if they are allowing a longer leave of absence policy, if that's something you're interested in, if you want to continue the coverage longer than this traditional 12 weeks, 3 months period. So again, not only are we here to help you with leave of absence issues, but we're here to help you with plan administration and any other compliance related issues that you may have. We don't have a formal leave of absence service, but we do provide resources. We have a memo on benefit elections during a leave that we can provide you if that would be helpful to you or your employer clients. We also provide administration for FSA, HRA, HSA, COBRA, POP, and transit, and that includes full service on those lines as well as compliance support. So we're here to help you on any of these topics. And if you have any questions, there are 2 options that you have today. We have a question box on the control panel. You can submit your question. John and I will hang around to answer those questions. If you have a question you'd rather email us, you can also send your question to compliance@probenefits.com, and we will circle back with you to discuss your issue. So we want to thank you for attending today's webinar. We know that it's a busy time for everyone, and we appreciate you being with us here today. Thank you.